begin.
Hi, good afternoon. My name is Claudia. I'm going to be your nurse for today. I'm going to be doing a full head-to-toe assessment on you today. That just basically means I'm going to be reviewing all of your body systems just to make sure that there is no abnormalities. Is that okay with you?
Yeah.
Okay. So before I do start, I just do have to ask you some quick questions. Can you please state your full name and date of birth for me?
Yeah, Daniel Flores, January 15th, 1999.
Okay, and can I check your wristband really quick? Okay, perfect. Can you tell me why we're here today?
Sure, I'm here to get a physical assessment.
Okay, can you tell me where we're at?
We're at a clinic.
Okay, and then can you tell me today's date?
September 26th.
Okay, patient is alert and oriented ×4. He is dressed for the occasion. He is in an erect posture and his speech is normal. So now I'm just going to continue asking you more questions. Do you have any allergies?
No, ma'am.
No, any allergies to food, latex, dust, pollen, anything like that? Any medications? No?
Nothing.
Okay, can you tell me who you live with at home?
I live with my parents and my brother.
Perfect. What do you do for a living? Where do you work?
I work part-time at a music store.
Music store. Okay, and how's that going?
Pretty well.
Pretty well? Okay. Do you smoke?
No.
Do you drink?
Sometimes.
How often would you say you drink?
Probably maybe 2-3 times a month.
Okay. Are you aware of the effects of drinking and what effects that has on your overall health?
Yes, ma'am.
Okay. So just make sure that you do control that alcohol because that can have potential damaging long-term effects on your body, okay? Are you religious?
No.
No. And then can you tell me your ethnicity, please?
Sure. Hispanic, Latino.
Okay, so now I'm going to be taking your vitals. Okay, I'm going to start by taking your pulse for a full minute, okay?
Sure.
So if you could just stay still for me. So your pulse was 76 beats per minute and your respirations were 15 breaths per minute, okay? I'm going to be taking your blood pressure. If I could have you put your arm here. Then I need to lift up your shirt a little bit, okay?
Sure.
How does it feel there? It's not too tight?
That's good.
Perfect. Okay, so now just rest your arm. Okay, your blood pressure was 119 over 74, which is good. Okay. Now I'm going to be assessing your skin, your hair, and your nails. So if you could just extend your arms. Okay, patient's skin color is normal for patient's ethnicity. Skin is cool to touch. Now I'm going to be assessing your hair. If I could just have you look down. Do you feel any tenderness in your head?
No, ma'am.
No. Okay, patient has no tenderness in his head, normal cephalic. There is no alopecia, no pediculosis, and no palpable lesions or masses. Okay, now I'm going to be assessing your fingernails. Okay, capillary refill is less than 3 seconds. Now if I could have you hold your fingers like this for me, please. Okay, and then there is no clubbing present in the nails. Okay, now I'm going to be continuing assessing your head. So if you could open your mouth for me, please, and say ah. Okay, uvula rises symmetrically. Tonsils are +1. Can you open your mouth again for me? Okay, oral mucosa is intact. There is no missing teeth. There is no lesions in the mouth. Cranial nerve number 9 and number 10 are intact. Can you stick out your tongue for me and move it around, up and down, left and right, please? Okay, perfect. Cranial nerve number 12 is intact. Okay, now I'm going to be palpating your temporal arteries. Okay, temporal arteries are a +2 bilaterally. Now I'm going to be placing an object on your face, I'm sorry. If you could please close your eyes and then just let me know when you feel it, okay?
There.
Okay, now can you go ahead and I'm going to place my hand on your temporomandibular joint. If you could just open your mouth wide for me. Close it. Again. And close it. Okay, cranial nerve number 5 is intact and there is no crepitus upon inspection of the temporomandibular joint. Okay, now I'm going to have you puff out your cheeks. Okay. Can you smile? Can you frown? And then close your eyes shut and don't let me open them. Okay, perfect. Cranial nerve number 7 is intact, facial nerve. Now I'm going to be inspecting your neck. You could just look forward at me, please. Okay. Okay, neck is symmetrical. And now I'm going to be palpating for any masses, okay? Okay, there is no palpable masses. Did you feel any tenderness in your neck?
No, ma'am.
No? Perfect. I'm going to be palpating your trachea. Okay, trachea is midline. Now I'm going to be palpating the lymph nodes. Okay, so occipital, postauricular, preauricular, tonsillar, submandibular, submental, and then posterior cervical, anterior cervical, and supraclavicular. Okay, there is no palpable palpable lymph nodes upon assessment. Now I'm gonna be assessing cranial nerve number 11. Can you shrug your shoulders against my resistance? Okay, perfect. Now can you extend your neck up? Now can you touch your chin to your neck? Now can you touch your head to your left shoulder? Now to your right shoulder. Okay, can you look to your left? And can you look to your right? Okay, now look at me. Now try to push against my hand. Okay, perfect. Okay, cranial nerve number 11 is intact. Okay, now I'm going to be assessing your eyes. So if you could just look straight at me, please. Okay, eyes are symmetrical. There is no discharge from the eyes. Eyes are light to dark brown. Sclera is white, and the conjunctiva is pink and moist. Okay, now I'm gonna have you look straight at me. Don't look at the light, okay? Okay, keep looking at me. Okay, so pupils are symmetrical, corneal light reflex is intact. There is no strabismus, and pupils are equal, round, and responsive to light. Okay, now I'm gonna ask you to follow my pen light with just your eyes. Okay, cranial nerve number 2, 3, 4, and 6 are intact. Extraocular movements are present. Again, pupils are equal and responsive to light and accommodation. Okay, now I'm going to be assessing your ears. So if you could just, again, look straight at me. Okay, there is no otorrhea present in the ears. Ears are symmetrical. Now I'm going to be touching your ears. Let me know if you feel any tenderness, okay? Okay, did you feel any tenderness?
Nothing.
No? Perfect. Now I'm going to be conducting what is known as a whisper test. So I'm going to have you cover your right ear. I'm going to whisper 3 words to you. Now if you could just, I'm going to whisper them, and then if you could repeat them back to me, okay?
ABC.
Okay. Now I'm going to have you cover your left ear, I'm sorry, and I'm going to do the same thing over here.
1, 2, 3.
Okay, cranial nerve number 8 is intact. Now for this one, I'm going to have you stand up, please. Okay, now I'm going to have you close your eyes and have stand with feet together, hands at your side, and close your eyes, and I'm just going to assess you for swaying, okay? Okay, sit down. Okay, so patient passes the Romberg test. There is no visible swaying. Okay, now I'm going to be assessing your nose. So if you could again look straight at me and actually look up a little bit. Okay, there is no nasal polyps or rhinorrhea, no discharge from the nose, or any lesions in the nose. I'm just going to be auscultating, palpating right here around your sinuses. Can you let me know if you feel any tenderness? Any tenderness here? Here? No? Here?
No.
Okay, now I'm going to do some light tapping. Let me know if you feel any tenderness. Did you feel any tenderness? No? Any tenderness?
Nothing.
Any tenderness here? No? And then any tenderness here?
No.
No? Okay. So now I'm going to be performing the sniff test. So I'm going to have you close your eyes, and then I'm going to put a familiar scent right under your nose. If you could just go ahead and tell me what that scent is, okay?
Alcohol?
Okay. So patient's cranial nerve number 1 is intact. Okay, now I'm going to be assessing your respiratory system. So I'm just going to start by inspecting your chest and your thoracic cavity. And then I'm going to be palpating around your chest for any tenderness, okay?
Sure.
Okay. Now I'm going to be touching. Please let me know if you feel any tenderness, okay? Okay, did you feel any tenderness at all? Any pain, discomfort, pressure in your lungs?
Nothing.
No? Okay. Now I'm going to be putting my hands right here. And then I'm going to ask you to take a deep breath, okay? Okay, take a deep breath in. Exhale. Okay, one more deep breath in. And exhale. Okay, so chest expansion is normal. Chest rises symmetrically. Now I'm going to be auscultating your lungs. I'm going to be listening to your lungs. So whenever you feel my stethoscope move from one side to another, if you could just take a deep breath for me and then exhale, okay?
Sure.
So I am going to have to go under your shirt, is that okay?
Of course.
Okay, deep breath in. Deep breath in. Deep breath in. Breath in. Okay, there is no adventition sounds in the anterior portion of the thorax. I'm going to be doing the same things on your backside, okay? Okay, again, I'm going to be palpating your back. You can let me know if you feel any tenderness, okay? Okay, did you feel any tenderness in your back?
Nothing.
Okay, no tenderness noted. Now I'm going to have you take a deep breath again and then exhale, okay? So breathe in. One more time. And breathe out. Okay, chest expansion is normal in the posterior thorax. So now I'm going to be listening to your lung sounds again. The same thing. You could just take a deep breath in and then a deep breath out, okay? And I'm gonna have to go under your shirt again. Is that okay?
Of course.
So lift your pressure a little bit. Okay, deep breath in. Okay, there is no adventitious in the posterior thorax. Now I'm gonna have you say 99. Can you say it?
99, 99, 99, 99, 99.
Okay, tactile fremitus is present. I'm gonna do the same thing in the front.
99, 99, 99.
Okay, tactile fremitus is present again in the anterior and posterior thorax. Now I'm gonna have you say 99, but this time I'm gonna listen, okay?
99, 99, 99, 99.
Okay.
99, 99, 99, 99.
Okay, performed bronchophony. Sounds are not audible. They're not clear. So it is negative. Okay, now I'm going to be moving on to the cardiovascular system. If I could have you look to your left. Okay, there is no jugular vein distension and there is no jugular vein pulses noted, excessive pulses. Now I'm going to be palpating your carotid arteries, your carotid artery. Okay, carotid pulses are +2 bilaterally. Okay, now I'm going to be palpating your heart, around your heart area. Again, let me know if you feel any tenderness, okay? Okay, aortic, pulmonic, herbs, tricuspid, and mitral. Any tenderness? No? Okay, there is no present tenderness or heaves present or palpations. Now I'm going to be palpating your apical pulse, okay? Okay, now I'm going to be listening to your heart sounds, okay? Aortic, pulmonic, herbs point, tricuspid, and mitral. Okay, there is no abnormalities of the heart. There is a present S1 and S2, no S3 or S4 gallops, and there is no heart murmurs. Now I'm going to be assessing your periphery for any edema, any swelling. Okay, again, just Show me your arms. Any tenderness when I touch your legs or your arms? No.
Nothing.
Your shoulders? No? Okay, there is no edema present. Color of skin, again, is normal for a patient's ethnicity. There is no cyanosis or erythema or any visible redness or inflammation of the skin. Now I'm going to be palpating your some of your pulses. So I'm going to be brachial pulse. Okay, brachial pulse is +2 bilaterally. Now your ulnar. Ulnar pulse is +2 bilaterally. Radial. Okay, radial pulse is also +2 bilaterally. Now if I could have you stand up, please. Okay, now I'm going to be assessing a pulse in your femoral area. Is that okay?
Of course.
Okay. Okay, femoral pulse is +2 bilaterally. Now I'm going to be assessing the popliteal. Can you go ahead and turn this way? Okay, popliteal pulse is +2 bilaterally. Can you sit down again?
Yes.
Move your socks a little bit. Okay, posterior tibial pulse is +2. And dorsalis pedis pulse is +2. Okay, now I'm going to be performing the abdominal assessment. So if I could have you lay all the way back, please. Okay, now I am going to have to lift up your shirt so that I can visualize your abdomen. Is that okay?
Of course.
Okay, perfect. Okay, so I'm just going to be inspecting for now. Okay, there is a couple birthmarks on the patient's left upper quadrant. There is some visible stretch marks. Okay, there is no lesions upon inspection. And then there is no abdominal aortic pulsations visible. Okay, now I'm going to be listening to your bowel sounds. So if I could just have you lay still, okay? Okay, patient has bowel sounds in all 4 quadrants and they are normal active. Now I'm going to be doing some palpating. First I'm going to start off with some light palpation. Please let me know if you feel any tenderness, and then I'm going to move on to a deeper palpation again. Let me know if you feel any tenderness, okay?
Okay.
Any tenderness here? Any tenderness here? Any tenderness here? Here. Any tenderness around your umbilical? Okay, there is no tenderness upon light palpation. And I'm going to be doing some deeper palpation. Okay, there is no tenderness upon deep palpation. Now I'm going to be assessing for rebound tenderness. So I'm going to put my hand into your abdomen. As soon as I let it go, let me know if there is any pain, okay? Pain? No. Okay, Blumberg sign is negative. Now if I could have you fold your right leg up to your abdomen. Any pain in your stomach and your abdomen? Okay, so sign is also negative. So patient is not showing any signs of appendicitis. Okay, now if I could have you sit up. Okay, now I'm gonna be palpating for your kidneys. I'm gonna strike the back. Let me know if you feel any pain, any discomfort, any pressure, anything like that, okay? Any pain? No? Any pain? Okay, there is no pain at the costovertebral angle. Now we're going to be moving on to your muscular skeletal assessment. So if I could have you stand up for me, please. Okay, and then just stand still for me. Okay, posture is erect. So now if I could have you walk that way for me, please. And then walk back this way. Okay, there is no altered gait. Now if I could have you walk tandem walking. If I could have you walk heel to toe, heel to toe, heel to toe. Okay, now I'm going to have you walk back on your tippy toes. And then walk back on your heels. Okay, again, there is no altered gait. There is no deformities of the body or anything. Body is symmetrical. Now I'm going to be testing the range of motion of your arms, your legs, the strength of your arms, your legs. So first of all, we're going to start off with the range of motion of your shoulders. So if I could have you put your hands up for me. All the way up. Bring them to your side. Down. And up again. To the side. Down for me. Okay, now pretend that you're swimming. Okay, now I'm going to be assessing the range of motion of your elbows. So if you could just flex your elbows as if you were doing biceps at the gym, working out biceps. Okay. Now I'm going to be assessing the range of motion of your hands. So if you could flex your hands up, down, up, and down, and move them around. Okay, perfect. So range of motion of his shoulders, his elbows, his hands, his wrists are intact. Now as far as your fingers, if I could have you touch each finger to your thumb, please. Okay. Okay. Now if I could have you put your hands on your lap and then alternate them. Start them off a little bit slow and then pick up the speed and then as fast as you can. Okay. So pronation and supination of the hands is intact, and then range of motion of the fingers is also intact. Now I'm going to be assessing your muscle strength. So you can sit down again. Okay, so I'm going to have you put your hands like this. I'm going to try to pull back. Don't let me pull back, okay? Okay. Now I'm going to be pushing against you, and you try to push against my hands, okay? Okay. Again, for your shoulders, don't let me push down too much. Okay. Now with your hands, if you could squeeze my fingers, start off slowly and then go increase the strength. Okay. Now I'm going to be palpating your hips, your knees. Let me know if you do feel any tenderness. But before we do that, let me know if you feel any tenderness up here in your shoulders, your hands, your fingers. No. Okay, now I'm going to be palpating your hips, your knees, and your feet. Okay. So move your hands to your side. Any tenderness? No. Any tenderness? No. Any tenderness?
Nothing.
Any tenderness? Okay, there is no tenderness of the lower extremities or of the upper extremities. Now I'm going to have you lay all the way down again. Okay, now I'm going to be testing the range of motion of the hips. If you could turn your feet inward, upward, inward, outward. Okay, put your knees to your chest, down, and try to lift your leg up as far as you can. Perfect. Down. Now with this leg, up to your chest. Okay, down, and bring it back up. Perfect. Okay, now with your ankles, I'm going to have you move them around. Okay, flex them up, and then down, up, down, and move them around. Okay, perfect. Now if I could have you sit up again. Okay, now I'm going to be pushing against down on your thighs and try to lift them up, okay? Okay, I'm going to be trying to lift up your thighs, and I want you to push down, okay? Okay, now I'm going to be pushing against your legs. Try to push them out, okay? Okay, now I'm going to be pulling on your legs, try to push them back in, okay? Okay, strength of the upper extremity and the lower extremity is intact. Now I'm going to be assessing for your spine. So if I could have you stand up, please. And if I could have you face this way. Okay. Okay, if I could have you touch your toes. Okay, and then I'm going to lift up your shirt just to inspect your spine, okay? Okay, his spine is symmetrical. There is no scoliosis, but there is a curvature of the neck in the cervical spine, an outward curvature of the neck in the cervical spine. Stand up. Okay, now try to flex your back backwards. Arch your back. Okay. Now try to touch your toes laterally. Okay. The other side. The other side. Side. Okay, now I'm gonna have you, okay, move your back like this, to your left side, to your right side, to your left side, and to your right side. Okay, so now for this last part, I'm going to be assessing your neurological system. So can I have you count backwards from 10?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, what is 2 plus 2?
4.
What is 4 plus 4?
8.
And 6 plus 6?
12.
10 minus 5?
5.
Okay, so I'm going to give you 3 words. It's going to be pizza, cheese, and red. I'm going to ask you those words at the end, so just remember those words, okay? So now I'm going to be assessing for any numbness of your extremities. So if I could have you hold out your hand for me, please. Okay, I'm gonna have you close your eyes. Okay, so this is what sharp feels like. This is what dull feels like. I'm gonna be touching different parts of your body. If you could just tell me if it's sharp or if it's dull, okay?
Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Dull.
No, we didn't repeat.
Sharp. Sharp. Dull. Dull. Sharp.
Okay, perfect. Now I'm going to be giving you an object in your hand. If you could just tell me what that object is, okay? If I could have you send your hand out and close your eyes. What is that?
The key.
Okay, perfect. Now if I could have you put both hands out, and I'm going to be drawing either a number or a figure. A number or a letter in your hand. If you could just tell me what those are, okay?
A.
Okay.
8.
8. Okay, let's try this one more time.
P.
Okay, very good. Patient was able to identify which letters and which numbers were drawn on his hands. He's able to distinguish between sharp and dull in all of the extremities, so there is no neuropathy damage. And he was able to distinguish which parts I was touching with the cotton. Okay, so now if I could have you repeat those 3 words that I told you.
Pizza, cheese, and red.
Okay, perfect. So that just about completes our head-to-toe assessment. Thank you for allowing me to assess you today. Do you have any questions for me? Any concerns with pain or anything like that?
No, ma'am.
No? Okay. So thank you again, and have a good day.
Thank you.